Good morning. I'm Dr. Reed Sheftal again, and this is Sreya and Dr. Sreya. This morning we're going to do the second in a series of 2 operations to reconstruct Sreya's hairline. And like I said, 6 weeks have passed, during which time we have injected the tissue expanders that we inserted during the last procedure. And as you can see, Sreya's scalp is expanded here and stretched, and that's going to provide us with extra skin to cover the defect when we remove the burned tissue right here. Okay? And during the 6 weeks, Dr. Sreya here, our very excellent dermatologist, has injected between 10 and 15 cc's each session into both of these expanders. Is that right, Sreya?
Yes.
Okay. And we'd like to ask Sreya a few questions about the experience of getting injected for the audience out there. And Sreya, is going to translate, okay? Can you tell us what it was like to be injected? Was it painful?
Nhưng biết là nhà nó bây giờ dương cũng chạm bằng với nhà expander nó bị chui đào thì yes, there's a little pain.
A little bit of pain, okay. And like we said before, she got between 12 and 15 cc's injected each time, right?
Yes.
Okay, so what normally happens is you put the needle into the port and you start injecting, and the first few cc's it's not too painful, but as you reach the limit
About
and it stretches
9,
the scalp,
10, yeah.
around 9 or 10 it starts to get painful. So we generally stop when it gets painful because we can use as many sessions as we want. And as you can see, how many sessions did we do total?
About 10
About
sessions,
10.
yeah.
So we injected between 120 and 150 cc's on each side. And the capacity for these expanders is about 300 cc's, so we're well below the limit. And Sreya, you were very careful not to hit the expander itself with the needle, right?
Mm-hmm.
Of course, which is a disaster because the expander will deflate instantly. And it's all been done very successfully. We're going to do one more session today before we go to the operating room. Sreya, do you have any questions?
You mean some way that it got going.
ខ្ញុំចង់សួរថាក្រោយការវះកាត់ហ្នឹងវាទទួលបានលទ្ធផលប្រមាណភាគរយហើយនឹងតើវាអាចប៉ះពាល់ទៅដល់ថ្ងៃក្រោយខ្ញុំធ្វើការធ្វើនេះវាអាចនឹងធ្វើឲ្យយើងឈឺក្បាលអត់
How many percent that we can expect for the success rate, and is there any complication
Okay.
to the process?
Well, today I would say that our success rate is very, very likely because we've already expanded our skin here. And we're going to be removing the expanders, so the risk of an infection or some other complication is very slim today. Having a foreign body underneath your outer covering, your skin, in a sterile area is always a risk for infection, but the scalp, I've never actually seen the scalp get infected in 20 years of doing this, so it was fairly safe to do it on the scalp. If we put expanders other places on the body, it's a higher risk of infection. Anyway, today I don't really expect to have any problems. We're going to go very slowly and as we always do, but we shouldn't have any problems today with complications. So we're looking forward to a very successful outcome.
ភាគរយយើងធ្វើហ្នឹងគឺបានជោគជ័យហ្នឹងគឺភាគរយច្រើនណាស់កាលនេះហ្នឹងតាមធម្មតានៅពេលយើងដាក់ expander ចូលវាជា foreign body អង្គធាតុក្រៅខ្លួនរបស់យើងហ្នឹងគឺវាតែងតែមាន expose ទៅនឹងបញ្ហាឆ្លងមេរោគក៏តែនៅលើស្បែកក្បាលគាត់មានបទពិសោធន៍មកគឺមិនដែលមានបញ្ហាទេអញ្ចឹងយើងឃើញថាការធ្វើហ្នឹងគឺយើងមាន success ច្រើនហើយយ៉ាងទៀតយើងបានធ្វើ expander ហ្នឹងគ្រប់គ្រាន់អញ្ចឹងអត់មានបញ្ហាទេ
Okay, we're going to be doing this procedure under local anesthesia with IV sedation, by the way. We will give Sreya some Versed and perhaps some ketamine also. But we will numb up the area with a tumescent solution, 1:1, lidocaine 1% with epinephrine and normal saline. And Sreya, are you ready to get one more injection and then go to the operating room?
យើងអាចចាក់បានម្ដងទៀតឯងមុននឹងចូលទៅវះកាត់យើងចាក់ចូល
ចាក់ខាងណាហ៎
យើងអាចចាក់ខាងស្ដាំ
បើខាងស្ដាំបានខាងឆ្វេងយើងនៅតាមចាក់
Okay, great.
There's maybe on the right we can do because the left we just done and now it's still tight.
It's still tight, feels sore.
Yeah, just
All right.
do it.
But this side is not too bad?
Yeah.
Okay, so we just did that yesterday. Okay. Okay, very good. Well, thank you very much, and we'll look forward to showing you the final result in